I am Dr. Paul, and I want to talk to you today about how the FDA spins the science on cell phone radiation and human health risks. This is part one of figuring out how you can protect your family and try to avoid the confusion that the industry has placed on cell phone safety. So, did you know that 40 countries don't even allow Wi Fi in nurseries and schools? They're in Europe. But why does the United States allow it? Well, I believe it's because the FDA has spun the science to make it confusing for consumers like you and me. Here's the question: what are you willing to risk? When they allowed smoking, it took 20 to 40 years before science said that it caused lung cancer. This is a new issue that we're facing. We're bombarded by cell phone energies and a whole host of other types of electromagnetic fields. My daughter had a huge negative effect from them because she is EMF sensitive. The question is, are you willing to risk? Are you willing to wait 20 years and potentially get cancer? Yes, it's controversial, but why is it controversial? So that's what we're going to do in part one of this series. They did a $30 million gold standard study demonstrating clear cancer risks. How did the FDA arrive on their position? They claim that there's not enough evidence, but according to Deborah Davis, PhD, she says their claim is untrue and misleading. The weight of evidence is that radio frequencies from cell phones and other wireless, in this particular case, it's mainly cell phones, does cause cancer. And to date, there is no consistent, credible evidence. This is what the FDA said after completing this $3 million study. They said that to date there is no consistent or credible scientific evidence of health problems caused by the exposure to radio frequency energy emitted by cell phones. And Davis said this: that document was never signed. What do you think about that? In other words, all the names of the individuals were not on there that reviewed this because they didn't agree with the FDA's conclusion. So Davis is a highly credible research scientist. She has over 200 peer-reviewed publications, books and journals. She has done publications on the Lancet, Journal of American Medical Association, and she is got good credentials. She has good credentials. So she feels that the reason why it was unsigned is because no one would be willing to put their name behind a piece of junk review. So the study says that there's clear evidence that male rats exposed to high levels of RF, like that used in 2G and 3G cell phones, developed cancerous heart tumors, and some evidence of tumors in the brain and adrenal gland of exposed male rats. This was, like I said, a gold standard program, and they were consistent and corroborated by dozens of other studies, and it's not like it was just a standalone study. So the panel of experts convened for a 3-day review of the study, and its conclusions were done in March of 2018. However, rather than downplaying the study's conclusion, the experts concluded that the scientific evidence in the study was so strong that they recommended the NTP reclassify some of its conclusions from some evidence to clear evidence of carcinogenic activity. So Davis said many of the experts spoke with her privately. One woman from Procter and Gamble was really concerned about her kids. She said that cell phone radiation is not appropriate, as I have said ever since I've raised my 4 children homeschooling. And she said, yes, that's what we've been trying to say for some time. In fact, more than 250 scientists together published over 2,000 papers and letters on the biologic effects of non-ionizing electromagnetic fields, and they basically signed an international EMF scientific appeal, which calls for the health warnings and stronger exposure limits. We are being overexposed, ladies and gentlemen. In 2018, they repudiated that study, and in February 2020, they released an unsigned literature review that criticized the study. The exposure chambers, the FDA said, are not relevant to humans. The radiation levels are too high. Davis said they were not. Davis was not alone in disagreeing with FDA's rejection of the NTP study. In fact, more than 20 scientists, including Davis, wrote a letter calling on the FDA to retract the literature review, and many scientists individually wrote to the FDA as well. Christopher Porter, PhD, a retired head of NTP who helped launch the study and still sometimes works for the federal government, said this is by far, far and away the most carefully done cell phone bioassay of biological assessment. So the 1990s, we point out that Davis pointed out that Motorola launched a disinformation campaign to confuse us, the public. And Sandler, who was part of that, said that there's a 3-point plan to impede further scientific research on cell phone radiation to create this disinformation campaign. One was to delay or halt the studies that were found by Dr. Lay and Singh from DNA damage by cell phone radiation. Two was preventing other scientists from replicating the study, and or carefully selecting scientists who would. And number three was convincing the press and the public that using these selected scientists, that the Lay Singh DNA study results were of marginal importance. Basically, they were trying to cause disrepute to the scientists that proved that there was cell phone damage. So while the work raises, so this is what they concluded to denounce the study that it did cause damage. Quote, while this work raises some interesting questions about possible biological effects, it is our understanding that there is too many uncertainties related to the methodology employed, the findings that have been reported, and the science that underlies them to draw hardy conclusions about its significance at this time. Well said. Well said. So are you willing to put you and your family at risk 20 years from now, finding that just like smoking, the laws have changed and the label says on your cell phone, warning, use of this cell phone is known to cause brain cancer, adrenal cancer, heart cancer in male rats? Are you willing to wait? Is it worth it for you and your family to wait? Well, I am not willing to wait. I protected my family, and there's things that you can do about it now. And I will send you information on this website about how to do that.